Welcome. My name is Rich Bowling, and like many of you, I own a business. We provide outsourced business solutions like assembling tools, putting together furniture frames, or picking, packing, and shipping for retail. I've got a lower wage workforce. Over 90% of my 380 employees make less than $15 an hour. They overwhelmingly choose not to buy the health insurance plan we currently offer. When the Supreme Court upheld the Affordable Care Act, also known as ACA, I knew I had a problem, a big problem, because I don't have providing health care baked into my costs, and my customers won't pay more for my services to allow me to pass the costs along. And whenever I've faced a similar problem in the past, it's my nature as a trained nuclear engineer to learn as much as I can about it. In this case, to figure out how I can survive and thrive in a world under ACA. Today, I'm going to tell you about a strategy that I have implemented in my business that will allow me to continue to grow profits in the face of ACA. In fact, I have turned this big problem into a big strategic advantage. Before I get to that, let me start with how this strategy evolved. In July of 2012, just after the Supreme Court upheld the Affordable Care Act, I had the good fortune of meeting a neighbor's house guest who works for the U.S. Department of Health and Human Services and is responsible for the design and launch of the federal healthcare exchanges being established under ACA. I posed a question she could not answer regarding the implications of ACA for companies like mine. A few weeks later, I find myself traveling east on I-40 outside of Asheville, North Carolina, talking to Ms. Liz Fowler, the architect and author of the Affordable Care Act. She told me she could give me 15 minutes of her time. An hour and 40 minutes later, we were still talking, and she had not yet answered my question. So she suggested that I come to the White House for a one-on-one discussion about my issues. On October the 3rd, 2012, I attended my one-on-one discussion at the White House. To my surprise, in the room, there were a host of personnel from the Departments of Health and Human Services, Treasury, Labor, and Commerce, as well as the Executive Office of the President. All in all, there were 12 people around the conference table, and 7 connected by conference call. At one point during the meeting, the ranking IRS officer at the table leaned over to me and gave me the kernel that launched my ACA strategy. Our approach is based on outsourcing to independent service providers. By contracting with the right ISP, your business can access the many benefits of outsourcing without fear of regulatory impact. My company, Productive, has developed a unique ISP strategy which features high efficiency, low cost, and is in full compliance with the Affordable Care Act. If ACA seems overwhelmingly complex and you are dissatisfied with the advice you've been getting, I can share a different perspective. Our strategy for growing your business by staying small.